Is Dr. Kausalya there? You're there? Okay. Ready? You're ready with your presentation no? After this? Yeah. And the last speaker is Lubna.
Aparajita. Next is Aparajita.
Okay. She is?
Arpita.
She's Arpita.
Yes.
Okay.
Yes.
Arpita.
She's Arpita.
Yeah.
Good afternoon, everyone. Today I am presenting Unraveling the Causes of Optic Atrophy, its etiology and implications. So, optic atrophy is not a disease, it is a morphological sequelae of disease. These are the late changes that occur in the optic nerve. In this process, axonal degeneration occurs in the visual pathway between retina and lateral geniculate body. And there are various causes of optic nerve shrinkage like ischemia, inflammation, compression, infiltration, and trauma. So, we have primary optic atrophy that occurs without any antecedent swelling of optic nerve head, secondary, which occurs due to long-standing swelling of optic nerve head, consecutive, which causes disease of inner retina and its blood supply, and glaucomatous, where there is deep cupping and nasal shifting of blood vessels. So, as we know that there is no effective treatment of optic atrophy, and the only solution is control of risk factors. So, early diagnosis and treatment of the cause is essential for better visual outcome and general health and life of the patients. So, in our study, we have evaluated the various etiologies of optic atrophy. So, it was a cross-sectional study performed at Dada Viren Puri Ji Charitable Eye Hospital, Jabalpur, for a duration of December 23 to May 24. Inclusion criteria was patient diagnosed to have optic atrophy on ophthalmic examination, and exclusion was not willing to participate in the study. So, methodology: disc pallor with diminution of vision, demography, etiology of disease, ophthalmic examination was conducted, visual acuity, pupillary reaction, and posterior segment examination. Data collection was done, demographic information was taken, medical history, any medication use, symptom course, paraclinical evaluation, neuroimaging, and visual outcome. So, we found in our result that 86 patients with optic atrophy were found, out of which 50 were male and 36 were female. Mean age was 45 years, range from 11 to 80 years. So, highest occurrence of optic atrophy was seen in 61 to 70 years age group. 31 cases were unilateral and 55 were bilateral. So, primary optic atrophy was seen in 26 percent of people, secondary was seen in 16, consecutive 10, and glaucomatous was seen in 34. So, in our present study, out of 86 patients, 50 were male and 36 were female. The disease was bilateral in 55 and unilateral in 31 cases. Highest occurrence was seen in 61 to 70 years age group, and glaucomatous optic atrophy was seen in 34 cases, and most cases were of primary open angle glaucoma. So, in a similar study performed by Bajracharya et al., titled Epidemiology and Causes of Optic Atrophy in General Outpatient Department of Lumbini Eye Institute, this was a cross-sectional study and 100 cases of optic atrophy were seen. In this study, 50 were male and 46 were female. The disease was bilateral in 26 patients and unilateral in 74 patients. In this study, glaucoma was the main cause of optic atrophy. In another similar study performed by Nayak et al., study of etiology of optic atrophy, this was a hospital-based cross-sectional study from July 2017 to August 2018. 100 cases were included. In this also 62 cases were male, 38 cases were female, and 70 cases were bilateral and 30 cases were unilateral. In this study also glaucoma was the main cause of optic atrophy. So, optic atrophy causes irreversible loss of vision. Hence, awareness about the etiology, early diagnosis, and treatment remains the mainstay for improving visual outcome and providing better quality of life to the patients. Glaucomatous optic atrophy was commonest presentation in our case, so awareness and early treatment is the only way to reduce its burden. Thank you.
Thank you for the presentation. So, how many cases did you take? So, was there a bias, or don't see any neurological cases where other than that also, like brain tumors and all, or only glaucoma was more into the session?
Ma'am, glaucoma.
So, which was the second highest cause for
Ma'am,
optic atrophy in your
glaucoma was the main cause, followed by primary optic atrophy, and then secondary, and then traumatic.
So what was the most common in those primary causes?
Pituitary adenoma, we first of all when patients came to our for our hospital, then we sent them for MRI and we found
you
that
just did a
pituitary.
observational study or any other correlation? Have you taken the OCT on all those in the
Yes,
picture?
ma'am. We have taken those who were having pituitary adenoma. They were sent to neuro physician for the further management. And for glaucomatous optic atrophy, we took over the cases to treat them, and for traumatic also. Like all the ophthalmological causes, we took over. And
So was this a prospective study or a retrospective study?
ma'am, retrospective also.
This was a retrospective study. So how did you distinguish between a primary optic atrophy and a neurological cause of optic atrophy?
Ma'am, neurological, we had the data also, and from the data itself we came to know.
So you have scanned the data, the hospital data of these.
Yes, ma'am.
Okay. So what was the second most common cause?
Ma'am, glaucoma, then primary like optic neuritis.
You just said
Yes, ma'am, under primary like pituitary adenoma.
it would have been nice if you had enumerated the other causes that
Yes,
you had
ma'am.
seen, isn't it?
Yes, ma'am.
Thank you.
Okay.
How many optic nerve fibers are there in a normal person? In an optic
millions.
disc, how many optic nerve fibers are there?
Ma'am, 2.5 billions are there.
And how did you differentiate, partial optic atrophy to complete optic atrophy? I mean, the studies that you carried out, was it a complete optic atrophy or a partial optic atrophy?
Ma'am, we took over mostly complete optic atrophy, and our main focus was distinguishing whether it is primary based on the appearance of the disc, like if it is grey, well-defined margins are there, and the etiology of the disease. According to it, we graded as primary, then secondary, ill-defined margins are there, post-neurotic or post edematous disc are there, so we distinguish according to it to secondary. Then we went to consecutive, like if there are any retinal pathologies like retinal pigmentosa is there, or any other consecutive those related to retinal pathology, CRVO, or any ischemic, post ischemic, so we distributed to consecutive. Then traumatic, patient giving history of any trauma, and so we distinguished into traumatic, and those having
Where does AION fit in? Anterior ischemic optic neuropathy. In your classification, where does that fit?
ma'am, primary.
Okay, thank you.
Thank you.